Hello, I'm Mia Waldron, and I wanted to present the study that was done in the NICU at Children's National, Parent Definition of Being Able to Do What's Important as a Parent to My Baby in the Neonatal Intensive Care Unit. This was a study that we had the privilege of doing with two staff nurses, with a staff nurse, Leah Foster, as well as multiple clinical leaders, Megan Belagamba, Hilary Silas, Marilyn Benalagay, Blair Harner, and Dr. Pam Hines was our mentor. So the background of this work was that in the NICU, we're aware that parents are overwhelmed often and in a very unfamiliar situation as they have a newborn baby that's hospitalized in intensive care. And in looking at the work that Pam Hines, Tessie October have done, looking at the concept of being a good parent in oncology and the PICU, we wondered if NICU parents had their own idea of what was important for them to consider themselves a good parent to their newborn baby. So that's how the study was born. And our aims were to identify the themes of being able to do what's most important as a parent in the neonatal intensive care unit, to look at the actions from healthcare providers that facilitate or hinder parents' achievement of their own definitions of being able to do what's most important, and to look at those definitions and compare those to family demographics. So the instruments we used was the NICU parent ranking exercise. It's a 5-minute questionnaire where there's 12 potential parent priorities, and these were based on the good parent priorities from the work from Dr. Hines and Dr. October that Dr. Chris Feudner created this ranking exercise, which is a series of four attributes where parents rank them from most important to least important. So first through fourth in importance. Then we did an interview guide that had 4 open-ended questions and 2 multiple choice questions that related to parents' perceptions of the most important factors of being a parent and identifying things that made it easier or harder for them. And then we did a simple 9-item demographic survey to collect general information about the families participating in the study. So the data was elicited from a convenient sample of English-speaking NICU parents through face-to-face recruitment and interviews. The questionnaires were done during the hospitalization in a 56-plus bed level 4 NICU. Qualitative descriptive research methodology was employed using the interview guide for the qualitative data and then content analysis. The questionnaire data was descriptively analyzed. So what did we end up with? So we ended up with 15 parents that enrolled that were primarily female, 9 mothers, 6 fathers. The majority were married. 12 of the 15 parents were married. They were primarily Caucasian. 10 of the 15 were Caucasian. The other 4 were African American. 1 was Asian. They were pretty well split on it being the first baby. 8, it was their first baby. 7, they had older children, but all 15 were first-time NICU parents. And they were also a pretty educated group with 9 of the 15 having graduate or doctoral education and only 2 having less than a high school education. So when we looked at the themes from the interview, what we found overwhelmingly was that staying at my baby's side, advocating for my baby with medical professionals, and making informed medical care decisions were the most frequently endorsed by parents. Interestingly, making sure my baby feels loved, in the ranking exercises, it came up as first most important in all 4 of the series that it appeared in the questionnaire, and tied with making informed medical care decisions. But in the interview themes and coding, making sure my baby feels loved appeared, but it was not one of the highest coded, didn't have one of the highest frequencies of coded responses. So what was the conclusion? All 15 parents were able to identify priority areas for themselves as NICU parents. The themes most frequently cited, like I said, were making informed decisions and focusing on my baby's health. The parent ranking exercise had making informed decisions and making sure my baby feels loved as the 2 categories as first most important. Focusing on my baby's spiritual well-being was identified as the fourth in importance in all ranking exercises, and it didn't come up at all in the interviews. Communication gaps and staying in the NICU were identified as the most frequent hindrances to parents doing what they felt was most important. The majority of the parents identified information sharing, education, and resources as the most important category for healthcare provider facilitation of their ability to be there to do what was most important for them as parents. In response to the questions about the degree to which parents were able to achieve their personal definition as a NICU parent, 7 parents identified that they were very satisfied, and 8 chose that they were able to achieve almost all of their definition. So what we learned is that parents in the NICU absolutely have a very clear sense of what it means to them to be a good parent or to do what was most important for them as a parent for their baby when they're hospitalized in the NICU. So despite the fact that that about half of these parents had not been parents before, they still had a very clear sense of what they perceive to be the most important thing as parents. And that information is helpful for us as caregivers because it allows us to partner with parents better if we can get a sense from them of what their priorities are, what they think is most important, and we can facilitate those things as we plan together and make a plan for care.